Now we'll quickly talk about another type of necrosis, that's tissue death, and this is what is known as the ischemic necrosis. So ischemic necrosis just simply means the blood supply to a particular place was cut off. So after time, the tissues there were dying off. Do you understand? Of course, it's not cut off ASAP. It's cut off that has actually been there for a very long time, you know. So ischemic necrosis is also called avascular necrosis. It's also called osteonecrosis. All right, that's when it involves the bone. Okay, so it's a death of tissues generally. You know, it could be muscles, could be ligaments, could be tendons. Do you understand? When it involves bones, that's when you have osteonecrosis. And that death is coming in because of what? Inadequate blood supply. So without sufficient oxygen and nutrients, cells in that area are basically dying off. Okay. So ischemia is reduced or blocked blood flow, while necrosis is now the cell death. Okay. So together is the tissue was dying because of what? Poor blood flow. So common sites, you have the bone, where you're having avascular necrosis. The brain, you can have ischemic stroke. Heart, that's myocardial infarction. The skin and also the soft tissues can be affected. So causes could be injuries, vascular obstructions due to side effects of some drugs, you know, alcohol abuse and the rest of it, sickle cell disease, radiation therapy, you know. So consequences could lead to bone collapse, it could lead to organ dysfunction, it could lead to a lot of pain, it could also lead to disabilities if left untreated, right? So diagnosis, mainly do or use imaging, MRI, CT scans, X-rays, you know, blood tests. So treat it using medications or reduce the weight on that part, you know. Also surgeries to now try to restore the blood flow or cut out the tissues that are already dead.